Welcome. Are you excited? It's Karen and McDonald here. And I welcome you today because it's going to be an exciting day. It's Friday here and we've got a lot to discuss. We can go into any different topic that you like to. Isn't that cool? So, anything that you want to go into, let's put it up for grabs, right? So, just put your question or anything you have as a burning desire because we can go anywhere we want to on the map. So, today, I want to talk a little bit about some of the things that's been coming up a lot in the last couple of weeks. As you know, they've been not only taking genetically modified mosquitoes, but we're also getting ticks all over. There are ticks, ticks, ticks. There's so many ticks going on. And even now, some of my friends have gotten infected. So now I'm to the point I'm really ticked off. So I want to go through some of this so that you have a fairly wide spectrum. There are lots of groups, obviously, on Facebook you can join and other different modalities that, people are looking at. But I think it's really important to take a look at it. So I want to put one of the I think probably the most diverse or open type of solution that we looked at. It was done by Dr. Dina Churchill. And she called me up because a couple weeks ago, she was actually bit by one of those little ticks. And it's not unusual. I know I've gone to Saskatoon. We never had ticks. I never had seen a tick. I was 40 some years old before I saw a tick, and I had to go out of town for that. Now you can't even walk along the river. You can't go to a park and you or the dog are being infected. A lot of people are getting in there. And one of my close relatives ended up being misdiagnosed. They're tired, they're depressed, they're lazy, they're attention deficit. And you know what happened when I did the Genius Biofeedback? Boom. First thing up was the ticks and the LYME with it. This is someone that, like I said, you can be a carrier. It can be dormant. It can be very mild to be literally to almost life threatening. There is pain to no pain. So it's got such a huge array of symptoms that I wanted to go through this because you know what? A lot of people missed it. And every professional I had met with my particular relative, and that's why I actually ended up developing the tick antidotes or the LYME antidotes and the co-infections and how we're going to talk about them in regards to rife and how you can use it, how you cannot. Also, I'm going to bring in some of the herbal protocols. I'm going to bring the essential oil protocols. There's going to be homeopathics. We're going to talk about minerals and supplementation is MMS, which is your chlorine dioxide. We'll talk when you cannot do, like I said, the rife. In conjunction with talking with Tony Pantrolesco, if people have been unjabbed, we'll talk about what he's got called the spike. So we're going to get all spiked up here and juicy. Again, without saying, you've got to establish the root chakra and get that into alignment first. So now that I'm ticked off, let's get going with some of this. So we're going to take a look in here. And one of the things is, what is Lyme disease? Lyme is known, and if you go down the rabbit hole long enough, you'll know that it was probably, they said, co-invented in a lab with BIOTECH in a place called Plum Island. Okay, and there are different kinds of bacterias, and basically that it can be tick-borne, and there's what they call co-infections. Now, if you were to go into the allopathic system, which I'm not sure why you would, because I can show you or can actually send the ticks to an actual place in the States, and there's as low as $60. There's packages $60, $100, and $200 packages that test anywhere from 18 up to 50 different types of infections and co-infections. But their first line of thought is, hi, if they don't like to think that you doesn't really exist or that you're delusional or psychotic and you're just having some like grandiose ideas that you think you've been bitten, well, there's the psych unit for some people. And I have seen that where they put Morgellon and Lyme clients into there because that is the way, in my experience, they have been dealing with patients for a long time. Otherwise, what they do, if they do admit that it actually is occurring, their thought is, let's do some antibiotics, which of course means anti-life. So let's not go there. So this is about not only just having recovery, because like I said, this can be long-term effects and it can be delayed. It can be asymptomatic and hiding really dormant. So a lot of times when you do get an infection, you may get a red rash and it may be there for a few days or could be even for a week or two. It can be itchy or non-itchy, but a lot of times people will start getting the other symptoms to do with the central nervous system, the higher chakras, almost like calcifying your third eye and the pineal gland, fever, headaches, extreme tiredness, the ability to move both sides of the face, joint pain, neck stiffness, even to people that have been misdiagnosed with anxiety, because you can get basically heart palpitations. And so a lot of this stuff, like I said, it could be even shooting pains down the arms, the legs, wherever. It does not have to be always in the site of where it occurred either. So again, it's a whole spectrum there. So do we really need all their amoxicillins and cefuroxime and doc stuff? No, we don't, because there's a lot of other things that can go on there, because people that have had persistent systems and persistent treatments and symptoms on here can have a post-treatment Lyme disease as well. Guess what? They can make it worse than what you started with. So anyway, one of the things that goes on here is a lot of times they'll suggest to use DEET. DEET is not, no one should be using RAID or DEET or bug off and stuff like that, because we want to see that. And right now, as of like the last 2 years, don't joke. If we didn't go through enough scamdemics, they're now proposing that we actually inject people with it to see if we can get actually a vaccine for it. But, you know, who knows what they're up to. So this now has been, they did do this once. It was called LYME-RX. Did you know that? LYME-RX. But you know what? They discontinued it because there wasn't enough demand. But don't you think that they don't have that here? Because they also have it for some animals as well. Like I said, you never know where this stuff is going to go down this rabbit hole that we're in. So like I said, it can actually take a week to 2 weeks to even incubate. And like I said, it's so variable in what I've seen with people, right? They can bite anywhere from into the legs. They like to usually get up. You'll see it a lot into the hair, the neck, along that sort of thing, up in, again, under places where you can't see. Okay. And it's really, really hard to take a look at that. So again, you may have a fever and may not. And like I said, what it can start doing is affecting people's red and white blood cells, or even the platelet count. And then, of course, we have something called co-infections. If it's not bad enough that we have that, we could get Borrelia, babesiosis. There's a whole bunch of things that we have as well. So like I said, asymptomatic to completely debilitated. And you never know how long this is going to be going. The other thing that we've seen a lot, and this is what I saw my relatives too, was it affects the cerebral spinal fluid. And I was actually out, and it's almost like when it gets involved, it starts affecting the meningitis. So we can also get basically not only the headaches, but the inability to move the neck and just stiff, and photosensitivity. In other words, intolerance to bright lights. But again, like I said, this can be very variable. And again, tinnitus is another thing. Vertical is another. Hearing loss, partial vision loss. And again, getting into the inflammation of all cranial nerves. Like I said, you can even get into facial paralysis and different palsies. So again, blinking, smiling, chewing, anything like that could be affected. And so, like I said, if that's not bad enough, then we get the inflammation of the entire spinal nerve roots. And that's where people get into immense amount of pains, numbness, weakening, altered sensations, altered temperatures, you name it. I've seen just about everything here. So again, even walking can affect the gait, you know, the speech, everything like that. And again, I've seen those people misdiagnosed as depression, like really anxiety disorders, bipolar, like, and this, always take a look for this, because they say 60, but I'd say probably 80, 90% goes untreated properly. Okay. Even things like TMJ and stuff like that could be actually connected back to the issues to do with the tics or the Lymes. And of course, with all this is going to be your subtle memory, cognition, focusing, and how about sleeping? Because of course, the insomnia is going to be in there. So again, these are not psychiatric disorders. They are not ADHD. They are not autism. They're not anything like this. And this is why I really wanted to go into this, because these sort of things, these spirochetes, and you see a lot of the gram-negative bacteria. They're the same thing almost like you see with people that have periodontal and stuff like that. And these are little spirochetes and stuff like that. And they have little, you know, tails on them, and they're called, you know, they have little flags, and they wiggle all over. And they're very similar to what you see in syphilis. Okay, so there are a lot of different things in here. And so these autoimmune diseases could be by a lot of things. Like I said, there's different kinds of Borrelia, and there's up to 50 different types of associative symptoms and co-infections with this. So like I said, and then you can get it into the animals as well, because that seems to be a very common thing. It doesn't matter if it's dogs, cats, rodents, birds, all of them are basically at risk for being a reservoir or a host for all of these. So again, a lot of risk for being a reservoir or a host for all of these. So again, a lot of people, like I said, it used to be about people deworming, but people don't even do that. So it's called what we call a zoonotic or zoonosis. And basically what it means is it transmits to humans. So again, it can be passed back and forth from animals in there. So they can have that vector going through there. And again, like I said, such a wide variety of symptoms here. And again, this can be a real issue, especially if women are, let's say, pregnant or with young children and neonates and babies, because again, they've got a weakened immune system here. So those are some of the things in here. I always laugh when they said, well, we haven't seen anything, on here, to do with, pregnancy and transmission and blood transfusions or sexual contact or breast milk. But seriously, what is not transmittable pretty well at some level? I mean, we even see the injections, so you can get secondary stuff as well. So don't think that you're totally safe about having intercourse or being intimate with people that do have it, because there is always such a possibility because of the co-infections. And like I said, they can come up and be exacerbated different things. So a lot of times the labs, when they're testing for this, right, they use Western blot tests can be done. ELISAs, ELISA, that can be done as well. And again, I'm going to show you someplace you can actually send it someone that's not, it's a private institution that you might want to do. And like I said, for $60 for peace of mind, you might want to do it in here. So this is the problems that when you're dealing with nanoparticles, right? And again, a lot of times their labs are not set up, or they neglect or don't want to tell people. So you've got different levels of labs. Let's remember that. And because there is such a differential dissemination of the diagnosis, it can be just about anywhere. So, similar, Lyme and stuff like that, can be similar, like I said, to encephalitis and viral meningitis and stuff like that. It's not that far off the, dropping from the cart here. So let's say that we're not going into doing the drugs, which I suggest you don't, let's look at some of the stuff that you could be doing right now. Okay, because there are a lot of things that we have available, and I will be on, hopefully, Typical Skeptic with Rob Khalil and Dr. Dina Churchill this Wednesday coming up, and we'll discuss it at a little bit more length. But I think this is important. I hope you guys are finding some value in this, because this is absolutely amazing. And so those are one of the things that we want to take a look at. And we thank you for joining us today, because it's really, really important. So in here, if you go back, I have put in probably about 20 links for you guys. I think that's that important that we need to go through. And so one of the things I want to talk about here is, what are the solutions that we can do? What are the essential oils? So if you've got aromatherapy, and again, we always want to be alkaline. So I always suggest people get your pH paper, get your litmus paper. I don't care if it's from Amazon here or the health store. These you have to get on Amazon usually, or medical supply store. These again are a 12 to 14 testing for your analysis. That's what it means. Your analysis reagent strips. Okay, so always get alkaline, because the more alkaline you are, the better it is, and keep it within about 7.5 to 8 on the urine. Like I said, you only have to test once or twice a week. It's not like rocket science. So one of the things in there, as we talk a little bit about what are the essential oils, if you go into the book, the best things for there is things that are heavy duty antivirals, which are going to be cassia and your cinnamon. Cinnamon bark could be used, and also things like clove oil, lemongrass, peppermint, oregano, and garlic. Those are your most common ones that you'll see, or using things like thieves. Because there's such a wide variety in there, there's such a thing called aromatherapy massage, or what you call raindrop technique. I would be doing that all the time. Again, skin irritations could be your things like lavender and tea tree and even peppermint. And one of the things too, you can buy even tick twisters, okay, different tweezers and stuff like that to remove it. But a lot of times people will say it's just putting even a drop of, peppermint and things like that they really don't like it. So I want to talk a little bit about the herbs though, because the herbs are kind of different. Herbs, there's some different ones called, most people haven't heard of. It's called Japanese knotweed, okay? And doing things along that line, using different things like chickweed. There's a variety of different things, ashwagandha, using those turmeric, things like that to build up the immune system. The autoimmune that happens with it, we basically want to go into adaptogens and dual directionals, which means it doesn't matter if you're too high or too low, it's going to help you. So those kind of things being used in herbs, teas, smoothies, tinctures, as basically as they think an antiviral is really, really profound. So a lot of times doing the tinctures rather than just a herb or a tea, because we're seeing with a lot of these infections, you get the biofilm. When you get the biofilm, you basically get like a leaky gut, you basically get plaque, you get like tar in there, and so you're not going to be absorbing. So absorption is the key. That's why a lot of times we'll go with tinctures and essential oils. They can be put directly on the skin, under the tongue, in with liquids, or again with enemas. I just went for an enema yesterday. And what I did is I made my own implant. I frequency implanted all the water with about 300 herbs for me and all the different people going yesterday. So that's a very, very important thing to do. One of the other things as well is something called the spike. Now, the spike was actually invented by Tony Pantalleresco. It's basically, it looks like a battery charger. And again, all your links are in there, so just scroll up. And so what happens, it looks like a computer battery booster charger. And then it's routed up there with basically 2 copper mesh spikes. It almost looks like, when you put pads on someone and we're doing, a crash cart EEG and it looks like a defibrillator, but it's done with copper things. And this is the idea, is to basically nuke and see if we can disseminate and kind of implode them and disengage some of the operating system within these. So Tony Pantalleresco is very big on trying those, only if under the circumstances you're not injected up the nose or into the arm or taken some sort of in the last few years. And so that's a very important thing. And again, using bromelain, NAC, bromelain especially too, and nattokinase for breaking down the biofilm that you're going to see with them. I want to go a little bit into the biofeedback aspect. And again, Rife. A lot of these, again, there are more than enough Rife codes. There are so many Rife codes for Lyme. It's ridiculous. There's an entire page and then all the co-infections that we have for Lyme. Again, these are built into a couple of the devices I use. And the reason why I found it to be so effective, what I did, and I will tell you the experience, back in about 2018, 2019, I mentioned a relative of mine was actually bitten. Okay, it wasn't until I scanned. I didn't tell the individual I was making the remedy or what we're doing. We went and put this stuff and I made the antidotes. And the reason I made the antidotes is because I got a hold of 3 ticks. I put them on our Tesla bifiller multi-wave, basically remedy plates. And from those plates, I was able to basically invert the signal 180 degrees. In other words, it's called reverse engineering or making an antidote to mirror the signal coming off of it. So if it's making a little signal like a telephone code to me, I just basically inverted it. And so what we did is that individual was able to get up within 24 hours. It was actually quite mind-blowing. It was a miracle to actually watch it happen. And again, the other stuff took a lot of time. So as you neutralize some of that stuff, as you go forward, then you have to deal with, again, the headaches, the photosensitivity, all this sort of stuff. Okay, so very, very, very important. They're all the fun things about when you're going out to garden, and a lot of people are using, let's say, duct tape and reversing it, making sure you got sticky tape, taping down your pants or putting at least your pants inside your socks and stuff like that. Do not take a chance. Be as covered as you can when you're outdoors and know where you are in the areas where they are prevalent, right? Where I noticed this was going to be when I started noticing out at Petrovka. All of a sudden, before it was tick season, there was a sign that said, beware of the ticks here. And sure as crap, months later, they showed up. Now, how would they just happen to know that? And why did they just happen to arrive at the, findaspring.org site of where we went and got all our spring water? Because these are strategically put. They are a direct energy weapon, in my opinion. So one of the things in there as well is something called MMS. We call it chlorine dioxide. Very, very helpful to have. Everyone should have chlorine dioxide. That MMS is actually on Amazon right now. Up here, we get it at Real Raw Foods. There are many places online to get that. This is strategic in healing. A lot of the different things, from whether you see AIDS, Ebola, or different things like that, that can be so, so helpful. And those are one of the things that I find that we really need to take a look at and do that. So having said that, those trace minerals that we're seeing and getting things in there, even hemp, CBD, getting into the cords in here, getting the cordyceps, getting the mushrooms, chaga, reishi, all things like that are very, very helpful. And again, if you've got NAC, which is your N-acetylene, okay, so, and if you've got the NAC, try and put them together, because one of the things too is that you want to basically get the glycine to start making glutathione. Okay, so anyway, those are very, very, very important. Another thing is rhodiola, right? Because a lot of these bugs respond to extra EMF, kind of like graphene. Anything in there, thyme, cumin, as I said, are really important. The cinnamon we talked about, eucalyptus, very, very important. So these are all things you should have on your bug out kit, your bug in kit, your first aid kit. Always have at least a dozen essential oils or get a kit. There are so many different protocols. I've put them in here. So if you want to look at homeopathy, the homeopathics and stuff like that, and if you want to look at chlorine dioxide from however you want to do it, or Andres Klocker's, Dr. Klocker's method, those are available as well. Like I said, there are so many. Look at chlorine dioxide from however you want to do it, or Andres Klocker's, Dr. Klocker's method, those are available as well. Like I said, there are so many different varieties, you know, just even the spirochetes, there's like 20 some of them. So like I said, we really want to get on top of this, because this is getting more and more and more prevalent. When I start seeing a lot of clients, then I start noticing if I'm seeing that amount, it's being exponential here. So MMS, there's a question here, is it no woman? Which I can be on days, but not the day I decided to take like probably about 8-10 times the normal amount required. I figure if they said start with 2 drops and I could start with like 20, hey, don't go there. So it depends on how you want to do that. So again, you may want to take it with food, and it needs to be very diluted. Some people could be more sensitive. And again, look at, rather than just mixing 1-to-1 ratios, you can look at the Dr. Andres Klocker method, and you'll see that you're diluting it. It's more like you're putting like it in a shot glass in a sealed hermetic container, you know, that you can flip down, and then you're getting more of a gas type thing. So take a look at that. There are different methods for doing that. So again, if you're taking it straight, yeah, you darn right it could be hard on the stomach. I've seen people actually put it straight in their mouth, and I'm like, you're not supposed to do that. You are just not supposed to be sticking it like a tincture or just some like mineral water. It needs to be diluted over a certain amount, and maybe you're just sensitive to it. So take a break. And a lot of times, like, there are protocols where you start doing, you know, so many drops every hour, like 2 drops and then 3 drops and 4 drops, and you keep, you know, upping it up during the day. So there are lots of different protocols. But that's some of the things that I wanted to kind of leave you with today. And I've got so many links there that I'd like you to take a look at. I think it would be probably the best thing is taking a look at it, because those little critters, they're almost everywhere. They're getting dropped. I know of areas in here where we don't have animals or ticks or whatever, but we now have got unidentified kind of weird things showing up. So who knows what's coming down? You know, like I said, we've had stuff people have never had before. And I mean, that becomes the problem, right? So if you start looking at that and we start seeing what's going on, well, then you're going to take a look at this. So in here again, take a look. It's not just the actual LYME per se. You are looking at basically something that's an injectable. And the same thing with a knee, as in being a needle, or an ejaculation. Either way, you are looking at trouble, okay? So take a look at that. These are not just isolated here. And that's why I really wanted you to take a look at some of this. One of the ones I put in here, it was actually something by Dr. Churchill, okay? All about the love bugs and stuff like that. Looking at the natural solutions, the plant medicine, the genus biofeedback. Like I said, I can do it with strictly in here. And this is what they're doing. They're tricking the system with these ticks. These are biological weapons, and they're even defined by the World Health Organization as such, as a harmful biological agent. That's too funny. Anyway, and that's the delivery system. So take some of the stuff that I've put up there because it's really, really, really important for you to take a look at that. I wanted to leave you with some of those thoughts, and we're going to leave it there. It's been a great Friday, so I'm glad you guys got to join me. I am going to be doing some more biofeedback and stuff like that. So if it's something that you want to scan, we have got lots and lots of scanners for those people in the biofeedback industry. I have my own recipes and imprints from the actual ticks, which can be sent out to people that do have the biofeedback machines. And I want to thank you for joining me. I'm Karenann Lusick McDonald. Take care and have a great weekend. Bye for now.